Welcome back. Despite all the medical advancements, we do continue to see cancer as one of the leading causes of death worldwide, including here in the U.S., where the American Cancer Society guesses that more than 2 million people will be diagnosed with some kind of new cancer case by the end of this year. Very sobering numbers always. And we often like to talk about some of the types of cancer that aren't as well known, perhaps, as others. Joining us today, we've got Dr. Warren Strutt, Chair of Surgery at HCA HealthONE Presbyterian St. Luke's. Thank you for being here.
Thanks for having me.
I know general surgery, you're going to see a lot of different type of cancer, certainly. And today we're talking about appendix cancer. Yeah. I got to be honest, that's not one I've ever even really heard that much about, right?
No, it's a rare cancer.
Okay.
We see maybe about 3,000 cases a year, so it's very rare.
Sad to say that rare still is in the thousands.
Yes. And what's more unfortunate is that we're seeing an increase in this. Over the past 2 decades, we've seen a significant increase, and unfortunately, one of the groups that we're seeing the biggest increase is actually patients under the age of 50.
I keep hearing that about a lot of cancers, which is really scary.
Yeah.
How do you even diagnose appendix cancer? Because in my mind, the only time you pay attention to your appendix is when it bursts.
Yeah, this is the trouble with it. It is a very insidious type of disease. Unfortunately, colonoscopies, you can't really see detect it because we can't see inside the appendix. Appendix is a small tubular structure, so it's very hard to kind of look inside there. Mm-hmm. Most appendiceal cancers are actually diagnosed after having an appendectomy after an appendicitis. So it's an incidental finding.
So it's been removed, and then suddenly you can look at it and say, oh, that doesn't look good.
We have a pathologist, they look at it. Appendiceal cancers are a group of different kinds of cancers, and so a lot of people think we treat them like colon cancer, but we don't always do that. So depending on the biology, it will kind of dictate how we treat them.
And that would be my next question, is what can you do? And I'm guessing that if it's often found after there's been some sort of a surgery before it, are you looking mostly for like metastasized cancer at that point, spreading in other parts of the body? What can you do for a patient that has this?
Well, again, it really depends on the type of cancer. Some are very aggressive and some are not so. Sometimes a simple appendectomy and we're done.
That'd be the easiest option.
That's the easiest option. While sometimes more advanced disease requires us to take a part of the colon out so we can look at the lymph nodes. The biggest issue is when we have a ruptured appendix and the malignant cells spread into the abdomen. And so when that happens, it changes what we need to do. And what we're very lucky about is that there's been some huge advances in the way we treat that.
Okay. Are there symptoms for a patient? I mean, how would you know?
Sure. So they're very vague. Some people present with appendicitis, which is right lower quadrant abdominal pain, while other people can have bloating, abdominal distension. And I would say if any of those symptoms happen or focal abdominal pain in the right lower quadrant, you should go and see your doctor. Anything that continues, you should go and see your doctor.
That was my next question, is when do you go get this checked out? It's never good to have lower abdominal pain ongoing, right?
It's not. You know,
don't brush it off, folks.
Absolutely. I think any kind of symptom that's out of the ordinary that continues, you should go and see your doctor. Too many people wait, and I think that's where it's a problem. If you are able to identify these things early, a lot of times we can treat these very effectively.
That's a good message to end on now. We're out of time, Dr. Strutt. Thank you for coming in.
Thank you for having me.
Always early action is the most helpful thing
Absolutely.
for the medical team that's going to have to help out. So thanks for coming in. Good info. We appreciate you here today.
Thank you.